My name is Dr. Melba Bonelli, and my doctorate is in dental medicine, and I'm from the Marlton, New Jersey area where my practice is, and I live in the city of Camden, New Jersey.
Thank you. About Dr. Bonelli, so I'd like to recognize her for a second.
Yes. With my organization in New Jersey, my corporation is called Dental Choice PC, and we have 7 employees. And I found over the years since I started, we've been in existence now for 9 years, and over the years I found that the policies that I've been able to negotiate have been where the premiums have been higher in my earlier years in the organization, and my employees weren't able to afford the higher monthly rates. And I had one employee in particular within the past year that had to have major surgery, and she did not have insurance, and it was unfortunate. And in the bed in the hospital, I spoke to her, and she says, "Dr. Bonelli, promise me that you're going to do something that we can all have dental insurance, that we all can afford it." And that really touched my heart when she said that to me, laying in a hospital bed without dental insurance at the time, having major surgery. And I said to her, "I will really try." And I pooled the different staff members to find out what they really could afford on a monthly basis. And my administrator and I, we started the trek of trying to find a plan that they can afford. And we found one that they could afford on the monthly premiums, but the deductible is now somewhere from $2,500 to $4,500. So they're all believing God that they never have to have major medical use of the plan, because they don't know how they're going to afford the deductible, although they can use the preventative side of the plan because of the low premium. So that's one of the things that I really had to deal with. And over the years, most of my employees have been single moms. Because I haven't been able to attract, well, I would say single moms that I've had to train in the workplace and bring them under my wing and teach them the fundamentals of dental science. And I found that the older population have been in the profession to recruit a staff like that, where I did not have to train, where they came with the expertise. I would have to offer them a full benefits package, because that's what they needed to come on board, and I was not able to do that over the years because of the cost. So that pretty much is my story in New Jersey, and I'm looking forward to the public health option insurance coverage, because I find that it will be, I'm hoping that it's going to give us a more diverse ability for everyone to be able to participate, where they're able to fully utilize all aspects of the plan if they need to, and there's a piece, because I think I've offered my employees a false sense of security that they have something that they can use, but in essence they can use part of it, and they're scared to use the other parts of it if they have to use it, and that's unfortunate at this time, but that's what is available to us in the state of New Jersey, and it's really...
It's terrible, so they're scared to use it.
Yes. That's where we are right now.